Request of 42 person upon you. I never want try lose you, try them upon me. Well,
this 26-year-old monster, Erin Elizabeth Ann Strautman from Virginia, was arrested on malicious wounding and felony child abuse as she was going around the NICU breaking the bones of black babies. I cannot make this up. As if black women didn't have enough to worry about when giving birth. In 2021 alone, the maternal mortality rate for non-Hispanic black women in the U.S. was 69.9 deaths per 100,000 live births. This is nearly 3 times the rate of non-Hispanic white women. Studies say some of the contributing factors to this are the cumulative physiological effects of chronic stress. Nobody is disrespected more than black women in this country. Nobody has more obstacles and barriers to face in this country, to overcome in this country, than black women. But I dare to say that the number one reason is because of racial bias in healthcare. So apparently what happened is that these young babies were having unexplained fractures. So the hospital increased surveillance, and the surveillance systems found her breaking the bones of these babies. Now, typically babies that are in NICU are already fighting for dear life, and then you've got monsters like this that are going out there and deliberately, maliciously causing harm. I personally spent 10 years in prison, and I can assure you it will not be nice.
I've been seeing on the news the stories of the nurse who was breaking babies' bones and she finally got arrested. Fun fact, I had to stay in that hospital for a week once. I had surgery there, went back because I had complications. They denied me nausea medication in the ER after a stomach surgery, so I threw up. That ripped my stitches. They had to give me an NG tube to suck out the contents of my stomach. I was literally bleeding into it. My mom, who's a nurse, says, I think she's bleeding. They gaslit us for a week. I continued to call them every 3 days for like 5 weeks after that because I was still shitting out blood for like a month and a half. They were like, no, that's normal. And so I finally go to a different doctor like 6 weeks later and my hemoglobin was like 5. Fuck Henrico Doctors Hospital.
Y'all, this story got me a little bit emotional because it hits really close to home for me. So in Virginia at Henrico Doctors Hospital, they have a NICU, okay? And in that NICU, babies started showing up with unexplained fractures and wounds. Now, this apparently happened over the summer, then it got a little bit better, and then it started happening again. It also happened a few times in 2023 to the point that the NICU said, we are shutting this down, no more NICU admissions until we figure out what's going on. And an investigation was launched. And it turned out a 26-year-old nurse by the name of Elizabeth Strautman was the one who is allegedly committing these acts, apparently for just funsies. Now, she has been charged with malicious wounding and felony child abuse, but let me kind of put my take on this. My daughter was born at 29 weeks and 3 days. We spent 43 days in the NICU. These babies are the most vulnerable of the most vulnerable. And the fact that somebody could harm children, let alone premature infants, is beyond reprehensible. And I hope that the full weight of the law comes down on her. So I will say this too. If you had a child in the NICU at Henrico Doctors Hospital in Virginia and you dealt with a fracture sometime while you were there, you may want to reach out to investigators.
I've been in such a state of shock after seeing the NICU nurse that was arrested in Virginia for abusing babies, specifically babies of color. And I did a contract there in 2021. And I'm pretty sure I saw her in passing, but obviously I was in the OR. I was not in the NICU. I've never worked in the NICU a day in my life, but I've seen a lot of NICU nurses weighing in on, oh, well, NICU nurses are never alone with a baby. Like, how is this possible for her to do this so many times? And why did that hospital system let her back? And all I'm going to say, as somebody that did a contract at that hospital, is they are chronically understaffed. Chronically understaffed. Our nurse manager at the time was a traveler. We had so much turnover in the operating room and could not keep staff. There were times where I worked 20 hours straight being called in the middle of the night because they were that short-staffed. That's how that happened. And it's unsafe, it's unacceptable, but I pray that bringing this to light will protect future babies there and The fact that people like that still exist in healthcare is so disheartening, but it is a reality. And nurses, if you see something, if you hear comments from anybody, report. Report, report, report. Because we have to protect these patients. As healthcare professionals, we take an oath to protect these patients. And even if you weren't directly involved in it, if you see anything concerning, if people are not treating patients equally, ethically, report it. I saw enough of that in Alabama, and I know that it is very real and completely exists, and it is so sad, but we've got to do a better job of reporting these kind of people and getting them out of healthcare, because that should never happen.
This NICU nurse was breaking the bones of these preemie babies for fun. This is 26-year-old Erin STRAUTMAN of Virginia. She has been charged with felony CA and malicious wounding. I'm seeing some articles say that she wounded 4 babies and some up to 7. So during November and early December, there were at least 4 babies with inexplicable wounds and fractures. This has been happening since 2023 apparently, and there have been up to at least 4 babies that had inexplicable wounds and breaking and fractures of bones that were in the same care as where this nurse was working when she was on shift. Now, parents of one of the babies who suffered at the hands of this nurse spoke out and said that they were heartbroken to discover that their preemie baby Noah suddenly couldn't move his leg in the hospital in September of 2023. They said it was kind of discolored. They told the doctor on staff that they got some x-rays and determined that he fractured his leg. Now, as I said, this baby Noah was just one of 4 in that summer of 2023 who were hurt. And so authorities opened a probe into these fractures that the different babies had. Now, she's apparently been a registered nurse since 2019, and she had been working at the Henrico Doctors Hospital. That's where all of this happened. Authorities are asking for anybody who might have had preemies in the hospital in this time frame, at least from 2023 and 2024, that if they have any recollection of injuries that their child might have sustained, to also report that so that they can look into this. So I feel like this is going to be an ongoing situation, an investigation, and I think we're just touching the tip of the iceberg, and this is just so sad and so crazy. And I will definitely keep you updated as I try to make sure that I find out the most accurate information to keep delivering.
This nurse targeted Black babies and broke the bones of 7 babies at a NICU unit. The abuse occurred at Henrico Doctors Hospital in Virginia. Over a 2-year period, this nurse was breaking the bones of NICU babies, the most vulnerable. And she only targeted Black babies. The reason she was discovered is because a couple had their twins at the hospital. One twin was doing better than the other, which is usually the case. And the one twin that was thriving ended up with a broken leg under this nurse's care. Why did it take 7 children's bones to be broken for someone to sound the alarm? This hospital needs to be held accountable. You know how many parents end up in prison because of nurses like this? Because they get accused of breaking the bones of their infant children? This woman is a monster to go after the most vulnerable. She was denied bond, but further, I want this woman to be charged with a hate crime because she only went after Black babies. How much hate is in you that you're going to go target infants at a NICU unit who were born prematurely and are fighting for their lives? She deserves life in prison with no possibility of parole.
Let's talk about the case of Erin STRAUTMAN, who is charged with malicious wounding of a child and felony child abuse as she worked in the NICU as a nurse. From the perspective of an emergency room nurse. I'm going to say it now before I go any further, but this is a huge trigger warning to this story as it does involve abuse of children. Erin STRAUTMAN is 26 years old and, according to the Board of Nursing, received her nursing license that is still currently active in May of 2019. It is unclear when she first actually accepted her position, but she ended up working at Henrico Doctors Hospital in Virginia. This case is just literally at the tip of the iceberg, if you ask me, but it involves multiple children that were born premature and had prolonged stays in the NICU where she worked. The investigation was started around November of 2024 when a father had concerns that he had received notification that one of his premature twin babies had received a tibia fracture during his stay in the NICU. Premature babies unfortunately do suffer breaks from time to time due to the fact that their bones are very, very, very fragile. However, this baby that I will not name suffered a tibia fracture, which is one of the longer bones in your leg. This, rightfully so, caused huge red flags for the parents as they were caring for their other twin. They went up the chain to the hospital to file an official complaint so that an investigation could ensue, which it did. Prior to this case being investigated, there were former complaints or at least documentation of at least 4 other babies in the summer of 2023 that had also had unexplained fractures occur. Why in God's name this wasn't investigated at that time, I will never understand. Because these parents filed a former complaint, there was a huge case brought forward and official investigation started. This meant that this NICU then went on a lockdown. It had major changes to the security of it, to include that there was 24/7 live streaming within the department. Within the time frame of late November and December of 2024, there was an estimated 3 other babies that were harmed during this time. The case at this time that's being investigated involves 7 babies. As we all know, once you uncover those, there are multiple more, most likely. Henrico Doctors Hospital actually put a stop to accepting new NICU babies, so anybody that was born there that needed a NICU stay was transferred out, and they closed their doors to accepting new babies in the NICU at this time. One of the cases that's being investigated involves a NICU baby that had a prolonged stay there that suffered at least 12 fractures during their stay. Let's talk about this from the perspective of an emergency room nurse. Unfortunately, in the ER, we get a lot of child abuse cases. Obviously, once the children are stable enough to do so, because some are not, we will do something that is called a skeletal survey. A skeletal survey involves a certain type of imaging that allows us to look at all of the bones of the children's body, but it will tell us where there are new fractures as well as where there are old. Bones leave a certain indentation when something has been broken, and those stay forever. Personally, having to do skeletal surveys on babies is gut-wrenching because it tells the whole truth. Essentially paints the entire picture of things you don't want to know. I'm assuming at this point that all of these children that were at some point in her care will go back and have skeletal surveys, and that will be a part of her case. She is sitting in jail in Virginia without bond, facing 1 count of malicious injury to a child, which can face up to 20 years, as well as felony child abuse, which can face up to 10 years. But I'm sure as this case goes on and more is investigated, they will find out that there are more children that she has put her hands on, and those years will just go up. I think all of us can completely agree as to where Erin should spend the rest of her life, which is never being able to step foot out of a prison, as well as never being able to see the day of light again.
Hi, my name is Tia. I'm a NICU nurse, and today I'm going to talk about Erin STRAUTMAN, the NICU nurse from Henrico Doctors Hospital in Richmond, Virginia, who was just arrested. I do want to put a content warning on this video. We are going to be discussing a nurse who intentionally harmed her patients, which is a sentence that makes me want to vomit. As a human being in the world, I know that there are monsters out there, but as a NICU nurse, I find this unfathomable. So the information that we have about the timeline starts in the summer of 2023, where 4 NICU babies were found to have unexplained fractures, broken bones. There is one of these families that has spoken out and has been on the news, and it's been reported that the mother of the NICU baby was actually a NICU nurse herself, and she reported the fracture to social services because something just wasn't adding up. CPS would send them a letter a year later confirming that the injury was from child abuse by a NICU staff member. Now, it's unclear whether this report to social services is what started the internal investigation back in 2023, but what we do know from the limited amount of information we have is that Erin STRAUTMAN was placed on paid leave after the summer of 2023. In the year that Erin STRAUTMAN was on leave and not working in this NICU, there were no reports of mysterious fractures or injuries to the babies. However, when she returned in the fall of 2024, 3 more babies were found to have mysterious fractures. In late December, the hospital closed its NICU to admissions so that they could perform an investigation. And then last week, right after the new year, Aaron Strautman was terminated and arrested the same day and charged with malicious wounding and child abuse and neglect. Now, police are still investigating. We're getting small updates essentially every few days, but the updates that we're getting are leaning towards these allegations being true. She also had, it would appear, an anonymous co-worker come forth, and they didn't have a lot of good things to say about her character either. One of the things they said, and I'm going to read the quote from the news source that I got it from, was, I was surprised at what she did, but I'm not surprised that it was her. If anyone was to do something crazy, she would have been at the top of the list. See, this is the part where I'm like, because you were told that your coworker was intentionally harming infants, and immediately in your mind you were like, checks out. They said a coworker was harming infants, and you were like, yeah, but it was that Aaron girl. Now that's gotta be some kind of giant red flag, right? Because if some person came into my NICU and asked me to point out the coworker that I thought would be most likely to intentionally harm an infant. Huh? None of them. Not a single name or a face comes to mind, because what the hell? But there's more. There are layers. This anonymous coworker also let us in on another tidbit, which officially the police have not released any details about the infants or the families involved in the case. We don't know their sex, their race, ethnicity in any official capacity. However, what we do know is that this anonymous coworker reported that the majority of the infants who were harmed were Black. Now let's call it what it is, right? The same coworker went on to say that in their interactions, she definitely felt like Aaron was racist. And this is problematic for numerous reasons, but given the fact that healthcare has a history of systemic and overt racism, coupled with the fact that Black infants have over two times the mortality rate of white infants already, the distrust in the medical community has been earned. As NICU nurses, this is really important. So please take what I'm about to say very seriously. I know sometimes it can be frustrating to feel like parents don't trust you. It always comes back to, I'm a NICU nurse, I'm here to help you, I'm here to take care of your baby, I want to help your baby, that's why I got into this job. But nurses like Aaron Strautman are a glaring example as to why there's distrust in the medical community. And we really need to come into ourselves and think about that the next time we're feeling frustrated, because we don't feel like we have the full trust of families that we're taking care of. It's not about us. As for the hospital, they have a lot to answer for. I have a lot of questions. Why did they put Aaron Strautman on paid leave for a year and then bring her back if they already suspected her of harming babies? That feels complicit to me, honestly. We know that Aaron Strautman's next court date is in late March. She does not have any bail set, and I will be looking for updates.